Okay, especially pleased to present our next speaker because he's a personal friend of mine for many years. Dr. Timothy Brigham will discuss physician and clinician well-being, which is a topic dear to all of our hearts. Dr. Brigham is Chief of Staff and Chief Education and Organizational Development Officer at the Accreditation Council for Graduate Medical Education. He is a teacher, speaker, group facilitator, and consultant in a variety of areas, including resident stress and well-being. Dr. Brigham holds a PhD in psychological studies and education from Temple University, a master's degree in counseling and human relations from Villanova University, and a Master of Divinity from the Palmer Theological Seminary. Please welcome my friend, Dr. Timothy Brigham.
Good morning. I think it still is morning, isn't it? I am incredibly honored to be here today. One, because you're you in this organization, but two, because I owe an awful lot of my own growth and development as a medical educator to pediatrics. For 19 years, I was one of the senior associate deans at Jefferson Medical College. And when I first came in as a young, wet behind my ears medical educator, the residents at AI DuPont Hospital and the faculty at AI DuPont Hospital for Children's in Delaware took me under their wing, let me design and facilitate their retreats. At Cincinnati Children's Hospital for a long time, I did almost all of their intern retreats. And then I was involved with Bob Dowdy and some others in doing the chief resident retreats that you all had. So I owe an awful lot to you, and I'm humbled by this invitation. I'm going to focus a little bit differently than most of the other speakers. I'm going to focus on the people in this room and your colleagues who are not here, but are part of your community, part of your neighborhood. This is my faculty disclosure. I have nothing to disclose. After this talk, you may decide that no one on earth would pay me to make this speech. Let me start with a step back. This is the mission of the ACGME. Most people are surprised that our mission is not to accredit. Our mission is the same as yours, to improve healthcare and population health by assessing and advancing the quality of resident physicians' education through accreditation, education, assessment, etc. We put residents and fellows on the path to mastery. It's an alchemical process where we participate in taking somebody who wants to be a physician and turning them into a physician. Yesterday was a sorrowful day 1 year ago. In Pittsburgh, a madman went into a synagogue, took the lives of 11 worshipers, and was taken to a hospital when he was injured. Almost all of the physicians and nurses that took care of him were Jewish, and the reporters asked in incredulity, how could you have taken care of such a monster? And the physicians and nurses responded back, it's what we do. We heal people. We're doctors. We're nurses. That's what we're talking about. When this journey moves forward, however, sometimes the journey's hard and the journey's long. This is Greg Feldman. Greg Feldman was a child prodigy by any measure that you would have. A genius almost in music, in academics, and in sports. Went to Harvard Medical School, where he was the valedictorian of his class. If you talk to the surgical faculty at Stanford, he was the best resident that they ever had. He went to another city. Within 3 months of going into a fellowship, Greg Feldman took his life by jumping out of a building. We began to work with a small group of us at the ACGME with his family to see what we could do about this. We had no idea of the scope of the problem. And in 2014, in August, 2 interns in the same specialty in the same institution in New York took their own lives by jumping out of a building within 4 days of each other. When Tom Naska and I and 2 others went to New York Presbyterian to see how we could support them, while we were in the air, an intern at Drexel in Philadelphia jumped out of a building and took his life. Just so happens that we went and visited right before one of our board meetings. Prior to that, we have our resident council, which represents 1 resident from every specialty. The chair of that organization of our resident council was the roommate of Greg Feldman in medical school. We got together, the residents said, we can't do this anymore. They went to the board of directors. The board of directors had the most moving, these are words you don't often hear in conjunction with one another. We had the most moving board meeting that I've ever seen. We have a big board, 40 people, most of them physicians. There was not one physician in the room who had not been affected by a suicide, either by one of their students, one of their residents, one of their colleagues, even thought about it themselves. There was real tears and crying, and the ACGME said, no more, no more. We move forward. We actually did a study that took a look at the death of residents and found that suicide was the second leading cause of death by the CDC of residents. Now, the good news is residents don't die of anything as frequently as their age comparison peers. But when they do die, they tend to die of suicide. It's the #1 cause for men, #2 cause for women. But if you look at below other medical and surgical diseases with accidents, ill-defined or undetermined, accidental poisonings, undetermined poisonings and falls, most of those, or some of those at any rate, you know were people who took their lives. It's just not on the list. So suicide could actually pop up to the #1 cause. We also know that by Sweet and Sen's research that residents, when they first come in at orientation on multiple specialties, there are about 3% of them or 4% of them are depressed. Within the first 3 months, it's up to 25%, and then holds, Lottie Derby in her latest research says up to 64% of all residents are depressed and burned out. Medical students at orientation are psychologically healthier also, and then quickly we know, those of us who are faculty, that we increase their depression, we increase their burnout, we increase their stress, we decrease their compassion, and we decrease their empathy. Practicing physicians, we know something about practicing physicians too, and your well-being. This is a seminal article by Tate Shannenfeld and colleagues in 2014 that shows the amount of burnout per specialty. Physicians in general, you can see, are at about 50%. The rate of the general population is about 25 to 28%. Here in 2014 were general pediatricians. There were pediatric subspecialties. Relatively speaking, next to your colleagues, you were less burned out. But you still exceed that of the general population. When they redid this in 2017, that was where everybody's rate went down in every specialty, but general pediatricians went up in the hierarchy of medical specialties. That's where the mean is the second arrow, general pediatrics was the first arrow. That's pediatric subspecialists. And we might ask them what is going on and what's the difference in what they're doing as we move forward. We estimate that about 400 physicians a year take their own lives. That's 1 a day if you take it, or to make it even more poignant, that's about 3.5 medical school classes just graduating students every year to take the place of physicians who take their own lives. What are we going to do about that? Well, what we know through Paul Batalden is that every system is perfectly designed to yield the results that it gets. So we decided at the ACGME we weren't going to tinker around the edges, that we were going to go for fundamental transformative change. And why the ACGME of all people? Well, my favorite philosopher, Jerry Garcia, says somebody has to do something. It's just incredibly pathetic that it has to be the ACGME. So what are the steps that we would take to do this? Well, this is an equation I want you to remember for the rest of the talk. It's an equation that actually changed psychology in 1936. It's B equals parens PE. Behavior is a function of the person in his or her environment. What we've been tending to do is we've been tending to focus on the person of the physician. We know and we suspect that about 70 to 80% of the problem with burnout, stress, etc., in medicine is environmental. It's a toxic mind in some ways. What we tend to do is every time we detect something like this over the years is when we detect that physicians in general or a particular residency program is too stressed out or too burned out, we give them resilience training, right? We do yoga, or we do breathing, we do whatever. And not that that's unimportant, I'm going to come back to that in a second, but it's like putting a canary in a mine, in a toxic mine full of poison, and saying we're going to teach you to hold your breath a little bit longer. Our job is to detoxify the mind, right? So remember that. This is what the ACGME's response to this whole thing. It's a lot of stuff. And since I only have 20 minutes and I've used up over 12 of my time, I'm not going to go through this in any detail. I am glad to talk to you afterwards. We have changed our requirements. We have a tools and resources section. We are working very, very closely with the National Academy of Medicine. In fact, the effort at the National Academy of Medicine started at the first symposium that we had on well-being of physicians. And we entitle our initiative Physician Well-Being, and we entitle it at the NAM Clinician Well-Being, because we have faculty and residents under our purview. Everybody in an interprofessional team is affected by this. Nurses, coordinators, etc. But we're well aware that the ACGME can't do this alone. We can't requirement our way out of this problem. It's going to take a culture shift, and that means working with the people who are sitting in this room. So how can we together begin to change this? Well, the first thing we have to know is, we're in this kind of territory. Here be dragons. There are, ancient maps. Remember the ancient maps of ancient mariners? They'd have Greece here and Crete here and Rome here, and they'd have a line and say, go beyond this, here be dragons, here be danger. We are sailing out into unknown seas in some ways. We have a really pretty good handle on the problem at this point, but the solutions are a little bit more difficult to get a hold of. But this is one of my favorite sayings from Martin Luther King that says you don't have to see the whole staircase, but you have to take the first step. And that's what we're doing, and that's what we want to do with you. We want to work together with you to collect and share data and do joint research, to share insights, to share tools and resources, to create a better world for physicians, other members of the healthcare team, and patients. And we want to do that environmental saying that they used to say, think globally, act locally. Because well-being is not simply the absence of burnout, it is the presence of joy. Now, I give a really good talk on joy. If you like this one, you can invite me back and I'll give it to you. But take my word for it. Joy is a very different thing than happiness, which is ephemeral. Joy is deep. Joy is profound. Joy is about connectedness to meaning and connectedness to each other. You can have a really lousy day and still be joyous if certain ingredients are involved. So how do you create this environment of joy and well-being? Well, you have to, we're going to go backwards here for a second. Why are we concentrating on this? Because clinicians who care for themselves provide better care for others. They're less likely to make errors or leave the profession. Habits to promote well-being need to be cultivated, and a healthy environment will lead to improved healthcare for all, both providers and patients. This is all about patients, all about the little children and the adolescents that are in your care in some ways. Well, here are the things that are really important. Does the environment promote self-care? Does it increase connection and support connection? And does it increase your ability to connect to meaning? I said before that about 70 to 80% is environmental, but it's still about 20 to 30% is within the physician. I'm going to tell you why this is so important, because we know at least 2 or 3 things that are different about you all in this room than the other people walking around in New Orleans. Right? You tend to be more conscientious than anybody else walking around. You will finish things that other people will give up on. One of the problems with our duty hours is not toxic and terrible program directors saying work longer. It's residents who want to take care of families 1 more hour. It's residents who want to take care of a patient as the patient is going through a very difficult time. Second thing we know about you is that you're pleasure deferring beyond what most people are. You're putting off pleasure all the time. Scott Peck, in his book, if you remember, if you're old as I am, he wrote a bestseller called The Road Less Traveled. In it, he defines an adult. He was a psychiatrist at Harvard as someone who can defer pleasure. If you like ice cream and don't like broccoli, you can eat the broccoli before the ice cream. Physicians and pediatricians tend to take this to a pathological edge. In fact, there's a poem that came from a workshop by a poet by the name of David Whiteran. I will give it to you in its entirety. It resonates usually with physicians. 10 years ago, I turned my face for a moment, ... and that became my life. 10 years ago, I turned my face for a moment, ... and that became my life. The third thing we know about you is that you represent the top 2% of people in the world. So since I don't know if there's any other people galactically in terms of your intelligence, achievement, etc. That's not what makes you special. What makes you special is the level of self-doubt that's running around in this room exceeds that of the general population by about 10 times. In other words, right? There are a number of you in here who are just waiting to be discovered to be the fraud that you are. You know about imposter syndrome now, and you know that everybody in here has it, but some of you have meta-imposter syndrome. That's when you recognize that other people have imposter syndrome, but by their achievements, they obviously are not imposters. You are the only one, right? And then you tend to run towards what everybody else runs away from, right? You run towards disease, despair, people who are injured, people who are suffering. That takes a toll. That takes a toll. Connection is the next thing. Positive social relationships are crucial to joy and well-being. Of all things in the world, where did we find this? In the Harvard Business Review, not in JAMA. That burnout isn't just about exhaustion, it's about loneliness. That the things that are the most important thing in terms of well-being at work has been found to be positive social relationships with others. In fact, another article in Harvard Business Review is the surprising power of simply asking people how they're doing. When our residents, the council I talked about, we asked them in a 3-hour appreciative inquiry that I ran with them, what was the most important thing that they wanted in terms of their own well-being, they didn't say a retreat. They didn't say more money. They didn't say more time off. You know what they said? They wanted somebody to come up to them, particularly in attending, and put their hand on their shoulder and say, how are you doing? And really want to know the answer. And really want to know the answer. And these are some things, by the way, the kinds of relationships that we don't need any more of. Harassment, bullying, mistreatment, discrimination. And using the power gradient to squash somebody who's trying their best to be a physician. The role of meaning. This is Maslow's hierarchy of needs. You all know what this is. It makes intuitive sense that you meet survival needs at the bottom of the pyramid, go up to affiliation needs, and then you hit the higher order meaning needs. This has never been empirically verified, Maslow's hierarchy of needs. In fact, you all know what Dante is going to say to you in a few seconds. Do you remember the first line of Dante's Divine Comedy? Midway through the journey of my life, I find myself in a wood, dark and deep, for the true way is wholly lost. You all know physicians with the kind of car that they want, with the kinds of houses that they want. They've met every particular need, and it's devoid, and their life is devoid of meaning. There's another way to think about this. If you haven't read this book, I would really advise that you do. You could read it on a plane ride. It's by Viktor Frankl. He is a Viennese psychiatrist who was imprisoned in a concentration camp and tried to figure out why some people survived and why others didn't, and came to the conclusion that if you could describe hope for the future or find meaning where you are, you survived. If you didn't, you died. Meaning then flips that Maslow's hierarchy of needs. Meaning is a prerequisite for survival. You find this out. If you haven't read this book, you should. When Breath Becomes Air. It's about a neurosurgery resident who finds out that he's dying and decides to, instead of going to Hawaii or doing something else on his bucket list, that to his dying breath, he would stay a neurosurgery resident because that's what gave him the most meaning. Why? Because of the connection to patients. That's what most physicians do. But here's a study. Here's what we do to our internal medicine residents. A time and motion study on interns in 2 tails of a test. One that they could work 24 plus 4 hours. The others, they were restricted to 16. What percentage of their time do you think they spent in direct patient care? 13 on one, 12 on the other. 12% of their time was spent taking care of patients. The rest was noise. The rest was noise. And what takes away practicing physicians' meaning? You all know this. You could recite this in your sleep. Documentation, administrative burden, electronic health records. We're taking the most... This is what we need to shift. This is what we need to take away so you can get back in touch with why you were a physician in the first place. What you have to know also is that one size doesn't fit all. This is a more complicated thing. This is the Clinician framework. It's a Welsh word that means habitat, and it categorizes organizational issues and problems in 4 ways. We're just going to go through 3 of them, and then we'll end very quickly. This is what we're all looking for, right? We're looking for best practices. They don't exist for this. Best practices usually comes from a simple problem, like a Betty Crocker recipe. If you don't put the eggs in the pancakes, the eggs don't taste as good. The second step is more complicated. It's still a cause and effect relationship, but it's more the realm of experts, but there's definitely one cause and one effect. Where we are with well-being is a complex situation. It's like putting a human being on the moon, or, to make it really relevant to you, like raising a child. Ooh, what worked for Becky doesn't work for Johnny, right? It needs, what has to happen in a complex situation is you need data and dialogue. So here's where we go. This is just to show you that it doesn't work that easily. On the y-axis is work-life balance. The higher you're up on the y-axis, the better your work-life balance. On the x-axis is the rate of burnout. There are 4 confounding specialties. They're your neurosurgery colleagues. They have no work-life balance. But compared to the other specialties, they're relatively well. They're relatively not burned out. Here are 3 up here: dermatology, rehab medicine, and emergency medicine, all with high levels of work-life balance, high levels of burnout. It's not a simple thing to figure out what to do here. What you have to do is in your environment, here at the AAP, in your institution, in your program, get people together. We're having our next symposium that we're having on well-being is with CEOs because they've been out of the conversation for so long. We need them in if we want to relieve those administrative burdens. Structure tasks, and then focus on the future, because when you focus on the future, you inspire. When you focus on problems, you tend to depress. This is a picture that went viral not that long ago. It shows the soul of a physician. It's a trauma surgeon who lost a patient that broke down at a wall. Millions of people hit this because it showed something about what it means to be a physician that most people are unaware of. What's wrong with this picture? What's wrong with this picture is there's nobody around him at all. Somebody thought it would be a better idea to take the picture than it would be to go up and comfort him. When this picture comes back again, I want to see a crowd of people around that person. And if you don't think you know how to do this, you just remember, if you think you're too small to be effective, you've never been in bed with a mosquito. And don't be afraid to try things and try them again. Because remember that amateurs built the Ark and professionals built the Titanic. 2 last quick stories. This is La Salle Fall. one of the preeminent surgeons in the history of the United States, first African-American president of the American College of Surgeons. He loved to tell stories, and he loved jazz music. And he was sitting listening to a jazz musician, John Coltrane, with another jazz musician, Cannonball Adderley, by his side. And they're listening to this recording, and Cannonball Adderley says, "Oh, did you hear that?" And LaSalle Lafall says, "Oh, yeah, I'm listening to that." He says, "No, did you hear that?" And LaSalle Lafall says, "What are you talking about?" He says, "Did you hear the grace note?" And LaSalle says, "What's a grace note?" And Cannonball Adderley says, "A grace note is one extra note that the musician puts in the measure just to delight the souls of the listeners." What I'd love for you to do, remember, nothing else that I talk about, is to be grace notes to the people who are sitting next to you, to be grace notes to the people back in your institution, to be a grace note to your residents, if you're residents, to be grace notes to your faculty, and all to be a grace note to your physicians. That's what we're trying to do. Because we're talking about awe, right? We talked about what physicians run towards and nurses run towards and other health care professionals run towards and other people run away from. Awe is an interesting word. It has two connotations: extreme wonder and extreme terror, right? In fact, they're two words that mean the same thing, full of awe. Awesome, which is that experience of wonder, and awful, which is that experience of pure terror. Our faculty and our residents and all of our providers are walking that tightrope where on one side is awesome, on one side is awful. And, you know, we're all telling a story with our lives. Me, too. You're not the hero of my story. I hate to tell you that. I'm the hero in mine until something happens to my child. The most precious thing that I have in my life. That is about the only time I turn the pencil or pen over to somebody else to take care and write the next sentence, to write the next paragraph, to write the next chapter. It is a holy, holy, awesome, awesome, awesome thing you are doing, co-authoring almost everybody's story as they move forward. And here it is. It's captured in a story in the Talmud really well, and this is what I'll end with. In the Talmud, there's a story about the courtyards in the ancient temple in Jerusalem. As you go closer and closer to the center, there's a series of courtyards. The more and more holy it becomes, until you reach the center of the courtyard, and there's a building with nothing in it. That is the house of God, and no one is allowed to go in there, because who can compare with the majesty of God? Only one time a year is somebody allowed to go in there, and that's the high priest. And the high priest has to do one function. He has to go in and say the name of God. Nobody knows what he said, because nobody knows the name of God. So they suppose that the priest went in and just breathed, or he wept. You all are in as close to temples as we have in the world, where people are taking their first breath or their last breath. People are weeping tears of joy because they didn't know that their cancer could be cured, like we just heard. Or they're weeping tears of absolute grief because the one that they love the most in the world, in some ways, their life has been altered, or they're about to be taken from them. That's where you exist. That's a daily existence of your life. Now, what they thought, though, was what would happen if something happened to the priest in the room? Because nobody was allowed to go in and get him. So if the priest fainted, or if God struck him dead or something, or had a heart attack, what would they do? So you know what they did? They tied a rope around his ankle that said, "If you fall, we will pull you out." So as you move forward, connect with one another and say, if you fall, we will be there for you. Not because you're incompetent, not because we don't believe in you, because we love you. Because we love you. Thank you.